Hi, I'm coming to you from Bagus Jetty in Bali, and I wanted to share with you some of the stretches that we discussed in our session today. Some may actually be new to you, and some may be ones that we went over. It depends on how far along you are in your session, but you can still follow what we're doing. I wanted to show you first just the jaw stretch when you're watching TV, or you can be in a car. And what I want you to do is I want you to find your cheekbone, go just a little bit below that, and you'll feel where that's right on your jaw, right on your mandible. Your maxilla is up here. You do not want to be on the maxilla, and you do not want to be on the cheekbone. You want to be just around your earlobes, or maybe a little lower. You rest your fingertips just the weight of a nickel each fingertip. You do not want to push in, just enough so that your fingers can catch onto the skin. Rest your arms on your chest, and you just think downward. And as you're thinking downward, and you can leave this here for 30 seconds to several minutes until your jaw finally starts to want to relax. You should feel some of the pressure change up in here. You can feel it in your ears. You can feel it up in your sphenoid bone, like across here. And when you're doing that, it's going to allow for your skull to do an elongation and give some room in your sinuses, as well as to help relax your jaw to keep from clenching and grinding. So and you can do this, you can repeat all of these several times, and you'll notice each time you're going to hit a different level. The other thing that you can do, we discussed, is you can lay on a pillow, or you can do it just as I'm doing it. I find it's best to relax by laying on a pillow. And you hold your fingers, and the same thing, just barely the weight of a nickel, maybe a little bit more. If your arms are on a pillow, they can be up like this. And you want to think upward a little bit, up towards the sky. You can also think back down towards the pillow. What you'll notice is you'll find that you have one ear that's a little bit different than the other. That's okay. Where you find that it might be a little bit too much tension, leave that little bit of pressure there. You can also go downward. You're going to feel this all through your skull. You also may feel this in the back of the neck. It's extremely important for you to do just a light touch so that your body can choose to let and release that. One of the next things that we're going to do, I kind of call this the cap lift. What you want to do is think like you have a cap on your head, and you want to put your pinkies down by your eye, just a little bit back, and your other fingertips will go just above the ear, or right along the line with the ear. You want to be right on your temple. Same thing, rest your arms on your chest, and you're going to think with the weight of a nickel, fingertips lifting up, just like you're lifting up a cap off of your head. And just hold your fingertips there for a little while. You can go back and forth just a tiny bit if you feel like you have some tension in there, maybe towards the back of the spine, maybe towards the front of the head. Do a little shift. You should feel a little bit of shifting in your sinuses. You might find that your sinuses open up. This is really good also for elongating that pressure. It's a great one to do on your own. All of these are good to do also for airplane pressure. The next one that we're going to talk about, I wanted to share with you also that sometimes you don't realize when you have a pinched nerve in your skull, and the pinched nerve in your skull can be pinching a nerve that can be affecting your digestive system or all of your systems in your body. That pinched nerve can also cause problems in your lower spine. If you have bilateral knee problems, whenever you have a bilateral problem, one on each side, it's going to be coming from the neck. So getting the pressure off of the skull and getting the skull to shift back in place where it needs to be is extremely important. The next one that we're going to do is to the base of the neck. One of the things I want to share with you too is a lot of times when we do stretching, you want to think about how your muscles work. And so I'm going to use a Chinese finger cuff for you to see this. When you push the Chinese finger cuff in, you can see that there's a nice opening for the blood flow to go through. You also want to think about all of this as being fascia on the outside, so you have nerves and blood vessels going through here as well. So when you stretch, if you're giving a pull, if you're going to stretch, you're actually pulling, and you can see how those fibers are going to constrict the blood flow. They can also pinch nerves that way. But if you give in and you push in like this, you can see how that's going to relax the area. So often if you just go to a yoga class to get to get your stretching in, what'll start happening is you're stretching and you're pulling, and those fibers start to tear. And I can show you on the Chinese finger cuffs where some of these fibers, you can hear that, where that fibers start to tear. And you have individual fibers, just like if you have a cable and you cut that cable, and inside all these little fibers, that's how your muscles are. So normally we were taught to stretch when something hurts. So when we do a stretch like this, it's very uncomfortable for your body. And as you're doing that stretch, you're pulling, and you could be tearing fibers. You're also putting pressure on your spine. So one of the really great things to do, instead of actually pushing on that, is you put your finger up in here, right along the base of the skull or right along the spine, and you feel the area, and you're going to feel that it's tight in there. And you're going to find a spot that's just a little bit sensitive. And you're going to turn your head up this way to shorten that muscle, and push your finger in just gently so that you feel pressure, and lean your head into it. What you're doing is you're shortening that muscle. This one in particular that I'm on right now is the levator muscle. And what's really important about that is the levator muscle connects in several spots on the neck, and then it goes down and it connects to your shoulder blade, and it actually does this torsion, this twist as it goes down. So shortening like that and being able to turn into it is really important, instead of pulling on that. Because when you pull on that, you are pulling on not just your muscles, but your spine, your discs. You can pinch muscles when you pull and when you stretch too much. So it's also important to be able to do that compression. That compression will allow that muscle to get the blood flow into it. It also will allow for the nervous system to start loosening up, and it also allows for the muscle to relax and choose to do it on its own. And the most important thing is to have your muscle choose to do it on its own. Just the same thing as when you're doing any of these exercises, is to let your muscles choose to do them on their own. You're going to get a lot longer stretch out of that. You're going to get a lot longer satisfaction, a lot less pressure. When your muscle is forced to do something, it sometimes goes into a fight or flight, and it will start to react by constricting back, and 2 days later you'll have pain again, which is one of the reasons that I am not a fan of deep tissue, because it will destroy the muscles, and it will start to strip the muscles, and over time it will weaken them. It also will cause problems for your ligaments. So in letting it choose, this is letting your ligaments and your tendons stretch and relax, and your ligaments and tendons are the ones that are going to suffer. You can work the belly of the muscle all day long, but when you work with the ligaments and the tendons and get them to relax, that's when you really start seeing that deep relaxation, because the belly of the muscle will let go when the final end will let go. And then your ligaments and tendons won't pull that belly of the muscle back. Thank you, and have a wonderful day.